Well, doctors are making a plea to the city tonight. Don't visit the ER for COVID testing or minor problems. They don't have room. I talked to a doctor at St. Luke's who says hospital capacity is maxed out.
Dr. Mark Larson needs your help.
I just need the assistance of my fellow Kansas Cityans to recognize when to use that emergency department and when to use an urgent care or just to stay home and isolate.
Emergency rooms across the St. Luke's health system are packed. COVID cases and other emergencies are pushing the system to its limit. And doctors now fear patients could die waiting to be admitted.
That's my fear. That's what keeps me up at night.
There just aren't beds available here or anywhere else in the hospitals.
Historically, we always clear our waiting room every single night, and every patient has been seen. But the last several days, that has not been the case.
And it's not just St. Luke's.
This is hands down the toughest surge the medical community has had to face since the pandemic began in 2020.
Doctors from all over the region report the same story at their hospitals. In Kansas, 8 people died awaiting a hospital transfer in November, but that number increased 5-fold last month.
It speaks truly to not challenging situations, but true crisis situations.
It's kind of a perfect storm right now.
With record COVID cases, the ER, he says, is right now only for true emergencies.
You don't need to get a test. If you've been exposed and you have symptoms, you just need to assume you have COVID-19 at this time.
Hospitals all across the metro are also now reporting record numbers of staff who are out sick with COVID. At the KU Health System, it is 640 people. That is 5% of their workforce. Doctors say if you don't need medical care that's not an emergency, check out some telehealth options. Masks will be required for everyone 2 and older inside public spaces in Douglas County, Kansas. The emergency order goes into effect Friday. It's going to last until January 12th. County leaders say COVID cases have rapidly increased over the past week. Missouri is suspending orders for at-home testing kits. That is, the state health department says that its computer system needs an update due to a rise in demand. Orders should resume tomorrow morning. Missouri lawmakers are back in Jeff City amid a rise in these COVID cases. KMBC 9's Matt Evans live in the State House this afternoon. Matt.
Yeah, Haley, masks are not required inside the Missouri State Capitol, inside the Missouri House, or inside the Missouri Senate. That makes some members uneasy about the safety of fellow lawmakers and the public here inside the State House in Jefferson City. As the Missouri House gavelled into their session earlier on today, several members were absent from the rolls. It's unclear exactly how many absent Republicans may not be here due to COVID-19. The House Speaker said he didn't have those numbers, but the minority floor leader said 2 Democratic representatives were not here today because they recently tested positive for COVID. Minority floor leader also had said also that COVID had impacted a number of Democratic staff members. Early last session, the Missouri House had to shut down because of positive COVID cases, something that House Speaker Rob Vescovo says he isn't worried about this year.
It's not a concern to me, no. I mean, listen, we all use common sense. If we're sick, I'm going to ask the members to stay home. They're all adults. They can police themselves, and if they're sick, they're probably going to stay home.
Acting like everything is fine is definitely concerning. You know, if you think about how much time we had to take off those 5 weeks when this all first started, the numbers are worse than they were then. So we are concerned, but you know, our caucus is doing everything that we can to stay safe.
And lawmakers get back to work with a lot on their plate, priorities that must be passed within the first couple of months of session, including congressional redistricting maps that have to be passed before candidates can file for those seats in March. On top of that, a supplemental budget will be passed within the first couple of months that will determine how Missouri could be spending a record amount of federal dollars. Of course, that's just a couple of things that lawmakers will be working on as they continue their work until May. We're live here in Jefferson City. Matt Evans, KMBC 9 News.
A CDC advisory panel is meeting to consider whether children ages 12 to 15 should be eligible for the Pfizer booster shot. The FDA already made their recommendation earlier this week. Right now, the booster is available to everyone 16 and older 5 months after they receive their second dose. If the CDC recommends the booster, it could become available to these children by the end of the week.